says recording in process. We know that people will be coming in. Hello to anyone who's joined already. We're just going to wait a couple of minutes to see if anyone else is making their way through Zoom. What do you think, Lucy? Should we give it one more minute?
Yeah, I reckon. Yeah.
Yeah.
Monday evening, everyone getting in and sorted.
Yeah, exactly.
Mhm.
Looks like we've got 12 people.
Well,
Okay. Should we start with introductions, do you think? And then if anyone if we notice the numbers creep up, we could always redo introductions.
yeah, yeah.
So yeah, welcome everyone to tonight's webinar. My name's Angie Lewis. I'm a clinical psychologist and I work for the National Specialist OCD and BDD service at the Maudsley, which is a service specifically for young people. But I run a satellite provision in the southwest of England, so I'm based down in Exeter rather than in London. Over to you, Lucy.
Thank you. Hi, everybody. Yeah, my name's Lucy. I'm a mum to an 18-year-old daughter who has BDD. And also, I've recently completed a master's in psychology. And as part of that, I did a dissertation about parents' perspectives of BDD in children and young people. So I interviewed around 13 parents of young people with BDD at various stages of their journey. Yeah, so I'm kind of coming with that voice as well.
Thanks, Lucy. So just in terms of how the webinar is going to run, we sort of made a bit of a conscious decision not to put loads and loads of information onto PowerPoint slides, because we thought that actually what people would most value would likely be just a space to ask questions and share experiences and kind of think about some of the stuff that comes up in the discussion. So obviously we have a few slides and hopefully the content will be helpful for people. But we're really keen for people to feel like they can just ping a question over to us. We were envisaging people asking questions verbally, but we've learned that actually I think that needs to be done in the Q&A section. So hopefully people know how to do that, how to pop a question in the Q&A. But we have got Kitty in the background doing all the tech, if anyone has problems with that. If miraculously we manage to work out how to give people audio, that would be great, so people can ask questions, but we're not sure if that's going to be possible tonight. So in terms of slides, I think, Kitty, are you going to be sharing slides? Fantastic. It's just quite an odd, surreal experience that you're talking to people that can hear you, but you can't hear them. I'm just going to lean into it. Um, so so the title of today's session is what to do when a young person doesn't engage in treatment. But I think, would you say, Lucy, we're thinking a bit more broadly than that as well, and just kind of, when young people maybe don't engage in conversations about BDD, or just kind of withdraw and shut off from life a little bit. So anything kind of within that realm will hopefully be of use to people.
Yeah.
Okay. So the plan for the session, we're going to think a little bit about the role of parents and carers in supporting someone with BDD. What do we mean by kind of non-engagement, what that might look like, some common reasons that somebody might not engage in treatment for BDD at this particular point in time. We're going to have just a mention on the role of insight in BDD, because it's a term that comes up quite a lot when talking about this topic. And then what I'm sure people are quite keen to hear about, some practical tips and ideas. And then we've put discussion and questions there at the end, but please do feel free to pop any questions in the Q&A as they come up, and we'll do our best to keep an eye on that, although we are not the most tech savvy, we've discovered this evening, haven't we, Lucy?
Definitely.
So we may fail miserably on that front, but we'll try. Speaking of tech, we have a video that hopefully is going to start in a moment. Kitty's going to share. So this is a video which is on the BDD Foundation website, but we worked at the clinic, the Maudsley Clinic, we worked together with the BDD Foundation to put together, and it's essentially based on interviews with parents whose children went through treatment at our service, and I think just gives it just captures, I think, a lot of the themes that come up for people. So I don't know if you're ready, Kitty, with that.
Give me 1 minute. I've got too many pages up. I will.
Oh no. I'm sure people will be familiar with this feeling of struggling with the technology. It happens to the best of us.
I would say just listen to what they're saying. Don't try and reassure them and say, oh no, you're the most beautiful person, because they won't believe that.
When you're asking again and again, do I look okay, do I look okay, I think even if the person says you look okay, it doesn't make you feel any difference.
It can be really confusing, I'd imagine. You're answering the question, you're trying to be helpful, but you get this really angry reaction. That's what it looks like. But of course, it's like a fearful reaction. When I was asking the question, I guess I was just desperately looking for some validation, but I was asking it in a way where it would be impossible to give me that validation. And there would be no way that I would accept the validation, pretty much.
I would tell them to talk to the person with BDD and ask how to support them. Don't rush, learn about BDD and things that keep it going. And I personally have found it helpful to talk to family and friends about my therapy so they know how to understand me better and support me along the way.
Talking to people and telling them exactly how you feel helps a lot when it's out in the open, because there are many things that people can do about it.
I think my biggest learning was I needed to be patient and listen to Jess and understand her of what was helpful for her.
It's natural for a parent to try and take some of the distress away from them, but you have to learn to try and cut back as the time goes on, which is something that I've learned with having therapy with Holly.
I sat in on a lot of the sessions, and I learned an awful lot about CBT in general, and it definitely helped me help her.
One of the key things for success is for the teachers and the school to really understand BDD. I wasn't aware of all Jessie's safety behaviours. I came aware of those through therapy. I managed to see her behaviour record at one point, and 20 times she'd been disciplined for wearing earrings or a non-uniform hoodie. And now I know that that was camouflaging and distraction from the face. And the sad thing was, you know, although she'd been disciplined 20 times, at no point had any teacher asked why she'd actually worn the hoodie or worn the earrings. And I think, you know, that left Jess feeling like she was a naughty pupil and labelled by the school. And I think it could have been handled very differently. And that was really despite them knowing that she had the diagnosis, but just not fully understanding how that might present itself.
Any parent that are going through the early stages of this, you know, you have my heartfelt sympathy, and all I can say is just keep reading the books, reaching out to people, make sure you get advice from the correct people. You really do need a big support system around you.
It does actually require you to invest some time. My work were really good. They were really flexible with time off. You know, if Jess was late for school and I was late for work, they were very understanding with that, which is great. But I think it's being very conscious that you might have to make adjustments to your daily schedule. And this is, you know, hopefully a short-term thing to get the long-term gain.
Everything's done step by step with how the person feels comfortable. So even if it takes a couple of sessions to do one thing, that's the way it is, which I think is really good.
Thanks, Kitty. If that's kind of prompted any questions from anyone, please do feel free to pop them in the chat. Sorry, in the Q&A while we get back to the slides. So, Lucy, do let me know if you want to chip in with this slide at all, given your position. Oh, thanks. It might kind of sound a bit obvious to think that you know there's a role for parents and carers. Of course there is, but particularly in relation to somebody who has BDD and is perhaps at a point in their journey where they are not engaging in treatment and maybe not even engaging in conversations about BDD, that role is particularly pertinent. It's really, really common for people who have BDD not to disclose their appearance concerns. And there are all sorts of reasons that this might be. People speak about really high levels of shame in BDD and fear of negative judgment. But often people also feel that their difficulties are not related to a kind of mental health presentation. And so they might seek support from completely different routes. And that's where I think parents and carers can be really crucial in terms of navigating somebody who has BDD towards the most appropriate service. And that can be a really tricky thing to do. Also, you might find that even if a young person manages to get to the right kind of service for their BDD, that unfortunately we know that often health professionals, teachers, other adults in key positions might not be at all familiar with BDD, how it presents and the impact that BDD might have on somebody's life, and how to connect with somebody on the topic of BDD. And so often parents and carers say that they have a really important role in terms of advocating for their child. And of course, it certainly shouldn't be the case that you have to kind of advocate in kind of mental health settings for treatment for your child, but it's a common theme that comes up for parents, feeling that they need to be really, really skills in terms of having the right information and knowing how to communicate that information with the system. And also this final point is about kind of recovery from BDD. And this is really, really important, that in order to maintain a recovery from BDD, somebody will need to think about rebuilding their life in a really meaningful way. So we know that BDD can really kind of prevent somebody from, particularly an adolescent, from being able to develop through those typical phases of adolescence in terms of peer relationships and education. So there can be a lot of work involved in kind of rebuilding that life. And so for parents and carers to be able to encourage young people to maintain those activities, maintain that structure where they feel that they have value, so the activities that they feel support their self-esteem and lift their mood and broaden their social network. These are all things that can be really crucial in terms of preventing further escalation of BDD, but also making sure somebody's in the strongest possible position to engage in treatment for BDD when that time does come. I don't want to put you on the spot, Lucy, but I also know that I'm at risk of just rabbiting on if I don't stop and ask if you want to add anything to that, but don't feel like you have to if you don't.
Oh, thank you. It actually, some of what you said made me think of some of the things we've got on some of the other slides about the way that you can do that. So we'll probably come on to the things that popped into my head. So yeah, thank you.
Perfect. Excellent. Okay. So what treatment and non-engagement can look like? So I suppose from my perspective as a clinician working in the NHS with young people who have BDD, what it would, by that point, obviously somebody has been referred to our service and we've offered them treatment, and we're trying to kind of get somebody through the clinic door, I suppose, and joining sessions and starting that road to recovery. But often even that point is where we might see some obstacles. So we might see people just kind of missing sessions, cancelling sessions last minute, being late to sessions, and that could be a kind of consequence of somebody's BDD. So the extensive behaviours that somebody might need to, the routines that somebody might need to complete in order to be able to make it to the clinic. But it might also be a real kind of ambivalence about the process and a kind of a resistance to actually coming to see you as a clinician, perhaps wondering what the whole point of doing this is and that you're not going to be able to help them. So often there's lots of factors that might contribute to that. We also often see people who do make it to the clinic, particularly obviously working with young people. You know, parents and carers can be pivotal in making sure that their child gets to the clinic, but obviously once they're there, they can't be made to speak. And so sometimes non-engagement is apparent more in how somebody presents in a session. So sometimes it's not saying very much, or sometimes it's just keeping things very surface level. So saying the things that, you think you're supposed to say in a session, and, sort of keeping answers quite minimal, but there being a real resistance to kind of going, I suppose, a bit deeper with how you're feeling and talking about some of the stuff that's quite tricky and upsetting to talk about. We see a lot of coming to session, but then not completing what we haven't come up with a better word yet, homework tasks. It's a terrible word because obviously it just makes no one want to do it. But what some of you might be familiar with is the idea of cognitive behavioural therapy, which is the evidence-based intervention, psychological intervention for BDD, really core in CBT for BDD is the idea of repeated practice. So you would do a task in session, often an exposure task, and between sessions, the young person would practice exactly what you'd done in session so that they can really maximize the learning that they get from that experience, and also generalize that to the real world, right? To real life, and practice doing that with people around them. and practice doing that with parents, supporting them. But this is another really typical area where we might see somebody just not kind of getting on board with, and they might be coming to the sessions, they might be talking, but then between sessions you don't see that work happening, because it's tough. It's really difficult work. CBT is a tough thing to do, and it requires real kind of commitment. So it's really understandable. I think that often it feels a lot more comfortable to avoid doing some of these things. And then finally, this is really common that we have people who, especially as a clinician, you'll feel like, oh, this is going really well. They're really engaged in treatment. It's all working really well. But actually, you get to a point where you recognize for some reason or another, it becomes clear that actually the person hasn't shared everything with you. Often there are kind of behaviors that somebody might engage with that they find incredibly shameful to disclose, or there are appearance concerns that somebody would just find it excruciating to have to disclose to somebody else. And so that just hasn't come up, and that happens a lot. And obviously, if we don't know the content of what someone is experiencing, it's really hard to work with that. And you made this point, didn't you, Lucy, about the bit that we've got in italics at the bottom there? I think that was something that you really felt. I don't know if you want to speak to that at all, and then I'm just going to have a look in the Q&A because I think I saw something pop in there.
Thank you. Yeah, this came out when I was talking to the parents for my degree, that a couple of people said that even though their young person didn't appear to engage during their treatment because they didn't want to speak very much and felt it really difficult to share stuff, their mum recognised over time that actually what had been talked about in the therapy sessions had sunk in, because her daughter began mentioning things and doing some of the things that had been talked about in therapy. So I just thought it was really important to include that fact, that whilst as a parent you might think, oh, they're not engaging and not saying stuff to the therapist, I think sometimes it can take a little while to process what's talked about, and being a young person can be quite awkward at that kind of age anyway. So, but it was just that note of hope, really, that things might be sinking in that might actually come out later on. So, yeah.
Thank you, Lucy. I was just scribbling down a few notes about the questions in the Q&A, because I think if we leave them all to the end, it might feel for lots of you that we've kind of missed the moment. So I want to try to get onto those in a fluid way if we can. So I won't read out the question completely, but we've got a question about if a young person feels that the only solution is surgery and what to do about that. Yeah, I mean, it's incredibly difficult, and this is something that we do come up against quite a lot in the therapeutic work that we do. So we said we'd mention insight a little bit later, and that's kind of one of the ideas around insight. Is for some people who have BDD, their kind of position, their viewpoint is that it's completely an appearance related issue and not at all psychological, and so the only solution is potential cosmetic surgery or other kind of adaptations to appearance. I think there's certainly no kind of one word, sort of one sentence solution to that issue. What we would do if we were working with somebody who takes that position is, I suppose, and again, we do sort of speak to this a little bit, so I won't go into loads of detail, and hopefully we'll sort of answer your question, but it's about supporting somebody to recognize that whether you might have very different views on what the solution to their problem might be. In your daughter's view might be that cosmetic surgery is the only solution, and your view might be that psychological therapy is the solution. actually what you can agree on, hopefully, and you can find, it takes time to do this, but find a way that you can agree on that the level of impact and distress that she's experiencing is not okay. Like that's not, you know, that's not where she needs to be. And so is there anything that she can be doing in the meantime that does address the level of distress and impact that her BDD is having on her life? So I don't know how old your daughter is, but there will be a time period before which she can't even consider surgery because of her age, and that is obviously a real bonus when we're working with young people, that we do have that breathing room where we can say, look, you know, that's something that you might revisit further down the line, but right now, why don't we explore other options? You know, why don't we explore things that, you know, maybe according to your perspective, they might not kind of fix your distress and your anxiety, but they might just help get you to a better place where you can cope a little better now. So it's almost like, I guess it's what we call in psychology world, we kind of call it contracting a little bit, where we sort of say, look, let's you know, set a little bit of a plan and say that you're going to commit to this for the time being and see where this gets you, and then we'll revisit this conversation. Because I think it's all about just opening up dialogue. So I don't know if that kind of answers your question at all, but I suppose the other thing to just share is that, and I wouldn't, you know, I'd think about how to share this in a sensitive way with your daughter, but the evidence is fairly clear that cosmetic surgery doesn't improve BDD. So if somebody has BDD and they seek cosmetic surgery, what we know actually is that the outcomes are quite poor, and that BDD doesn't improve, and depression and low mood actually are quite likely to increase. So perhaps that's just an idea to gradually kind of bring to focus a little bit for your daughter. And then the second question is about a young person who's on a waiting list and is completely disengaging socially from friends. And this parent is concerned about whether she's going to be in a good place for treatment, and because the impact this is going to have. And I totally recognise that it's a really understandable concern. I suppose my suggestion would be to think about whether there are any things that your daughter can do short of engaging with friends, if that's a real red line for her right now. But is there anything else, any other activities she can do that elicit a sense of value for her, that elicit a sense of achievement for her, and that brings some structure into her life? So it might be that there's things that she can do that bring that sense of value and achievement, that aren't socializing with other people. Of course, that is what we'd want her to do. But I think it's about just finding anything that someone can do to still build that kind of broader sense of who they are outside of appearance. I think we've got another question, but what I might do is go back to the slides and then pick up questions again in a moment, just so that we can get through. Does that sound right?
May I just say one thing, Angie?
Yeah, please do.
That links with the question about somebody who thinks the only answer is surgery. And again, you would know how best to convey this information to your daughter. But the BDD Foundation have a podcast called Beating BDD, where an interviewer has interviewed over time lots of individuals with lived experience of BDD, and one of the recent ones actually is of a lady who did have surgery to try to deal with her appearance concerns. And I think it would be a really interesting one maybe for you to listen to first and think whether it's something you could share with your daughter. But I think often hearing a story from somebody with lived experience understandably resonates a whole lot more. So, and there was also one a recent one with somebody who is neurodiverse, and I think there was a reference to that within one of the questions as well. So as somebody just commented in the chat, the Beating BDD podcast series is fantastic. So there's we can all resonate with different people. So yeah, it's just to share that really, in case you don't know about that.
Thank you, Lucy. And just as you mentioned the podcast, it also made me think about the second question about the young person disengaging socially, and thinking actually about whether whether she'd consider connecting with people through the BDD Foundation as well, and kind of the peer support networks that are available, because it might be that it feels safer to engage socially with people, A, online, but also B, who understand where you're coming from and understand what you're going through. Okay. So insight. So I mentioned this briefly before. It's a term that does come up a lot in BDD, because it's important to understand where somebody sort of sits on the continuum of insight in order to kind of really get to grips with how to have the conversation about BDD. I think it's important to note that insight isn't kind of like a one standalone fixed construct. Like it varies depending on what aspect of BDD you might be talking about with somebody, and it can vary from time to time. And it's something which often, and it's sort of an expectation of ours, improves through treatment. So insight generally, it can refer to somebody's perspective on the BDD diagnosis itself. So when I was saying before, somebody who perhaps doesn't think that this is in any way a psychological presentation, that it's completely a physical one, that might be somebody who's perhaps lower on what we would call the kind of insight side of things. But I think it's important to think more broadly than that as well. And insight can be somebody's kind of belief that psychological treatment might be able to help, somebody's kind of belief in recovery. So in treatment, when we're talking about insight, this is what I was mentioning previously, what we really try and focus in on is somebody's acknowledgement that actually the distress that they're experiencing can be helped, right? So the distress, so it might be that we have very different ideas on what's causing that distress, but what we can agree on is that that distress needs to be improved. We need to work on it, that they could live a better version of the life that they're currently living. They could live a version of the life that they're living that is not kind of plagued by anxiety, and that is not impacted to the degree that it is by the worries that they have. So it might sound like a subtle difference, but it's quite an important one in terms of opening up that conversation. Because often if we try to talk to somebody with what we'd describe as quite low insight about BDD, they might just shut off from that conversation. But if we have the conversation about the level of distress that they're experiencing and the impact it's having on their life, and what can we do about that, often people are much more open to that conversation. So yeah, I think that's pretty much everything on that slide. Okay, is this me again, Lucy, or is this one you? I can't remember.
I think it was me actually.
Yeah.
Yeah. Thank you. I'll try to whiz through, because I'm aware we've got quite a few questions in the Q&A, so I don't want to take up too much time. But yeah, some common reasons for not engaging in treatment. We've touched on some of them, that people can feel embarrassed or ashamed sometimes about having appearance concerns. So they might think people will view concerns such as these as trivial or associated with vanity, whereas actually the polar opposite is true. They might have difficulty accepting that the problem they have is a psychological one when they are viewing it as a physical one. So they therefore they can't see how therapy such as talking therapy or medication can help. So, and similarly, they might not believe that therapy can work. It can sometimes take a long time to access the right treatment, as I'm sure many of you are aware. And on that journey, a young person might have told their story to different people quite a few times and might feel like they've told their story but haven't been helped. So it can sometimes be really difficult when they do get to the right person to tell their story again, which is where I think the establishing the trust with the therapist comes in, and feeling safe to do so. And also it can be frightening to think about changing behaviours when you've been carrying out those behaviours like camouflaging or avoiding social situations for a long time. It can be really, when you've been doing them to feel safe and to cope, it can be frightening to consider doing things differently. I think, yeah, did you want to add anything to those, Angie?
No, I think it's a really strong summary. Thank you, Lucy. I was also just catching up with the questions in the Q&A, and it's just really hard, isn't it, to hear about people's experiences.
Yeah.
You can really feel just through what people are typing how desperate things can feel. And we've got somebody who's describing their son who says he just doesn't want to get better. And I suppose what I would, it's so hard. The psychologist in me wants to ask so many questions about that, which obviously I can't do here. But I think my instinct there would be to move away from a conversation about getting better, because that might feel quite overwhelming and threatening and scary, because I guess your son realizes it would mean dropping all the behaviors that he feels are keeping him safe, and actually move the conversation more towards, well, what could be different in your life? What could we do that just would make things feel a bit easier? Is there anything that you're struggling to do now, to any small tiny goal that actually you'd quite like to be able to do, that you'd quite like to be able to move towards? So I think any of those conversations that feel like it's a bit of an impasse, it's just moving away from those and just being more curious about kind of whether there's anything that he could tolerate thinking about. And then we have somebody who I think quite similar, is not engaging socially and at home. And I think the same advice as before, just anything that I think when it comes to BDD, because social withdrawal is such a huge part of how BDD can present and can be so impactful. I think I've said this a few times, and I probably sound like I'm repeating myself, but any small wins that you might be able to have in terms of structure, even if it is just tiny things, leaving the house and doing something that feels like it has some sense of meaning, rather than doing what people often do, is they kind of set themselves quite high goals, or like parents might set quite high goals for the child. So if you're out of school, we want to get you back into school, or if you're not seeing friends, we want to get you back into your football club. Like actually make like really kind of reducing down to much smaller steps that feel a bit more manageable. Okay, should we go to the next slide? I think was the next slide you as well, Lucy? I can't remember.
Think so, yes.
Yeah.
So yeah, these are some tips that we've pulled together, but we're really open to, if any of you have suggestions to add to this, feel free to add them in the chat. So just firstly to say, we're really mindful that not all of these tips will work for everyone, and so it's for you to think about what might help your young person, because you know them better than anyone. So firstly, it's to give a message of hope, and I recognise, I really do, especially when reading some of the points in the Q&A, how desperate and difficult things can feel. So none of what we're saying is meant to come across as easy. It is literally sharing messages that other parents have given. So of the parents that I spoke to for my course, people who'd been through the journey, had been on it for quite a long time, all of them were saying the similar thing, that with time things had got better, and that what had been really, really dark days had improved, and that as their young person had grown up, and I literally mean got older and matured, that their insight into their condition and in the way they manage it and cope with it had developed, and that things had got better. The thing about dealing with small setbacks, one of the parents I spoke to said that in the early days for her daughter, if she had a bad day, it equated to a bad life. And yet as time went on and she realised, actually, sometimes I have better days than yesterday, a bad day became a bad day rather than a bad life. So that one day might be awful, but the next day might be better. And a dad I spoke with said exactly that, and he recommended writing a journal, a diary. He said he found it really helpful to be able to look back and see that although he'd had 3 bad days in a row, or his daughter had, the next couple of days had been much better. So it's just to kind of share that tip. The thing about making small accommodations, yeah, Angie's mentioned this, the idea of looking at and talking to your young person about, is there anything that we could do that might help you do something that you want to do? So whether it's going out in the car somewhere, or giving a young person a lift to school or to college so that they don't have to walk if that's what's bothering them, being seen by more people. What was the other? I had another idea. Yeah, going to places at less busy times. The message that came through from quite a lot of the parents I spoke to was about stepping back and listening to what their what it meant for their young person and what might help them. Because I think as parents, and I totally speak for myself, that we can sometimes think that we know how we could make things better for them, but it was just a reminder from the people, the parents I spoke with, that actually step back and listen and see what might help them, in their words. And then again, to focus on anything that kind of brings happiness or joy. So one of the mums I spoke with was in a really, really difficult situation with her daughter, who hadn't been out for ages, and I mean months and months, and wouldn't allow herself to be seen in the house by any of her family members. But what they did was watched the same television program, albeit in different rooms, but then they could have a conversation about that program, or listen to music together. So it's kind of finding any way to connect, because I totally appreciate, and from my own experience, how limited a young person's social circle can be, and by that I mean it can be zero. So often as parents, we can be the only person our young person has social connection with. So it's just about trying to maintain that in any way that is feasible. And then the sharing information with your young person, it links a bit with what I said about the podcast. So it often, as parents, we're the ones doing the research because we're desperately trying to help. So we often come across those examples of people that have lived through BDD or live with it, that we can then share that information with our young person, either by describing the person's story, or if they're up for it, for sharing the link to the website or to the podcast or whatever. Again, as parents, you know them better than anyone. I think that's all.
I was just scribbling some things down as you were speaking there, Lucy. I think you've said them all as you were speaking, but I just wanted to make a point on, it's such an important point on the, can we go back a slide, Kitty? Sorry. Thanks. On the making small accommodations, it's a really important thing, because often parents will say, but I'm not supposed to, I'm not supposed to accommodate BDD. And by accommodate, we mean kind of make changes in line with what the BDD wants, because that then fuels kind of impairment. So this is something that is very true. And in treatment, we support parents to gradually reduce accommodations. So if you've got to a point where you're driving your child to school because they don't want to walk, you might, with the agreement of the child and everyone on board, you might gradually reduce that to get them to a point where they're walking to school. But that's very different because that's during treatment. And I guess what we're saying here is that if your child isn't in treatment and you're in a very different kind of mode, and it's just about doing anything you can to keep your child as active as possible and as engaged in the world around them as possible. So if that does mean making some of those accommodations, just like Lucy said, some great examples, that's why you're doing those. So I think it's important saying that, because sometimes parents say, oh, but I'm confused because we get told not to. And I suppose that's why it's a difference between being in treatment and not in treatment. And I suppose I was also just, it was really lovely to hear you talk about those examples, Lucy, about kind of listening to music or watching a TV program, because that's something that I was thinking as you were speaking, is the importance of finding ways to connect with your child that have got nothing to do with BDD, because parents often say, and young people as well, that their whole communication is saturated by this disagreement that they have, and it is infuriating for parents who desperately want to see their child get better, and it is infuriating for children and adolescents and young adults who desperately wish that people would recognize how they see themselves. And it can it's tough, and you're not going to be able to just convince each other otherwise. Whereas if you can find those pockets of time and activities where you can just connect as a parent and a child and work really hard to park that BDD discussion, because the temptation when things are feeling relaxed is to just weave it in, but to actually say, do you know what, we're not going to talk about this. These are our moments of BDD free time. That's so valuable, because if you can keep your child talking, that is a massive win. And it's good for all of you, and it fills your bucket, and it means that you do get those social connections together. So I think that would be a massive push for everyone. So yeah, they were just a couple of points that I was going to add. Is this you or me?
I think it's you.
Is this me?
Yeah.
So well prepared. So a lot of this is we've probably covered to some degree. I mean, it sounds really simple, doesn't it? Saying don't argue and disagree about the appearance, but find common ground. Oh, that's what I was saying a moment ago. Look at that. But it is actually really hard. This is something that we have to do in therapy as well. When working with a young person who's got BDD in sessions, I have to work really hard not to get into, it almost pulls you into a disagreement about whether or not their kind of appearance beliefs are true and valid, and that gets you absolutely nowhere. So it's really important to resist that temptation and just find, like I was saying earlier on, find that common ground, find what you can agree on. Maybe you can agree that wouldn't it be great if you could get back to netball, and what are the steps we could do to get you back there? Wouldn't it be great if you could see that friend that you haven't seen for a few weeks? Or wouldn't it be great if you and I could go and have a coffee at that new cafe? Like, find the bits that you can agree on. Yeah, so I guess this is a bit more in terms of if what we've been speaking a lot as if your young person isn't in treatment, but if your child is in treatment, but you feel like they're not engaging, it can be really useful to explore how you might be able to be involved in some sessions. So I think sometimes parents have had experiences where they are not involved at all in their child's therapy. And sometimes that's appropriate, if there are certain reasons that decision's been made. There are lots of reasons why that might be appropriate, but sometimes it's just kind of fallen that way and no one's really questioned it. Whereas we know that obviously BDD is a condition that can affect the entire family in terms of its impact, and the entire family can have a role to play in the young person's recovery from BDD. So, you know, I think it's really appropriate to ask the question, you know, would it be useful for me to be involved in a session, or is there a way I can communicate with your therapist and with your child's consent, and how can I do that? Because your perspective as parents is so valuable, and I can say this as a therapist, it is so valuable to hear from parents about what they're seeing and what their perspective is, what their view is, what they think is working, what they don't think is working. So definitely do kind of recognize your value in that therapy process as well. And this is a really important point. This last point is, often if somebody is in treatment but they're not quite engaging in the process, often we find it when we're trying to build motivation to engage, we're trying to get young people to kind of recognize what their life can be like. For an adult, that might be easier because you've got this whole history that you can look back on and think about when life was better and what did I do and what didn't I do and what kind of makes me tick. Whereas for a child who's obviously got a much shorter lifespan, there's less to draw on. So often adolescents can find it really hard to think about what is their kind of normal without BDD, and what life could be like and what life used to be like when they were younger before BDD developed. And those kinds of conversations can be really helpful as well, whether you're having them in the home or as part of the therapy room. But just supporting your child to perhaps open their perspective a little bit and recognize that there was a life before BDD and there will be a life after BDD. And I think that can be a really powerful conversation to have. Okay, so just before I go to resources, I'm just going to check the questions.
Yeah, so I'm just reading through.
Yeah, I've kind of lost track of where. Yeah, we've got another question about insight, and I hope, this is from Rachel. Rachel, I hope that some of the things that we've just said about kind of managing those conversations, hopefully they will help answer your question. I think that's what I would lean back into if I was answering your question now. A question about reassurance. Oh, yes, I completely recognize this. I suppose the thing I would say, Jane, about reassurance is you can validate how I think you said your son, you can validate how your son is feeling without reassuring him about his appearance. There's nothing in, you know, it's not like you're not going to cause damage by telling him that he looks lovely, but I guess it's just that he's not going to hear it, right? And it can become a compulsive behavior in some instances. Some people can then kind of seek reassurance almost compulsively, but it's more than I think it's just, it just gets you in this a bit of a cycle where it's not getting anywhere. Whereas what you can do is you can say, I just recognize the validation part is just saying, this is tough, this is horrible, and I'm so sorry you're feeling this. And I want to do everything I can to help you feel better. And what can I do to help you feel better that doesn't involve reassuring you? You know, what are the kind of, what are the ways that you've always looked after your child and cared for him and soothed him when he's distressed? And you can lean into all those strategies just as you always have, whilst, you know, not necessarily giving reassurance, just because we know that it doesn't get us anywhere with BDD. But what you can also do is help him recognize all the things that are brilliant about him that have got nothing to do with appearance. So that's a huge part of recovery from BDD as well, is building up someone's confidence and recognition that they are, you know, if you do a pie chart of who you are, appearance is just one tiny little sliver, and there's all these other things that make up who you are. So recognizing those. Conscious we've only got 5 minutes. I know that we did have a question before about an OCD action group webinar. I don't think we could make a direct comment about it because I'm not familiar with it, but I know that they're a brilliant charity. So I'm sure any support they are offering would be great.
Yeah, I think it was a concern about whether it's advisable for the person's son to join a group like that because the parent is worried that he might hear distressing experiences or feel that his own BDD is not serious enough. So it's just to get a sense of whether it's advisable to join a kind of support group. I think that was the question.
It's hard to say without more details, but I think broad stroke, it's always helpful to connect with people who would recognize your experience. So I'm going to just quickly go through this, and then if you've got a couple of minutes, answer the last questions, I think. Is this our last slide, the resources one? So this is, there's not a huge amount to say. Obviously, there's tons of resources out there, but these two are great books. The Parent's Guide to Body Dysmorphic Disorder, it's a really great book, and it outlines a lot of what we said today and more. And the one on the left is just a really small book, which is a really useful resource, maybe for somebody who's kind of not sure if they really meet the diagnosis of BDD, or parents or school teachers or people around them don't quite recognize it. It can be a really great information resource. Someone's asked about having a BDD specific therapist, and I would it's difficult to say because there are so many brilliant therapists out there, but I would say that in my experience, it's beneficial to have a therapist who understands BDD specifically, because there are lots of nuances to working with BDD. So if you can access a therapist with that experience, I would really, really encourage that. I'm just having another skim. It was that our last slide before I do kind of, I think it was, isn't it?
Questions.
Yeah. So we've got a couple of questions about small comments, really. So somebody's mentioned a podcast, and somebody said if there's any groups in the US that we're aware of. Not off the top of my head, but I know there's amazing work being done in the US. There's lots of research being done at Harvard Medical School in BDD, and there's the OCD. It's gone out of my head. I want to say International Foundation, but I might be wrong. And they might be able to direct to some resources. But yeah, putting on the spot, my mind's going slightly blank. I don't know if anyone has any final questions. No, look at that for timing. Thank you so much, everyone, for joining.
Thank you.
Yeah, it's a tough subject and a lot of ground to cover. So I suppose just before we do close, I just want to end with the genuine hopeful note that it's really important to share that BDD is absolutely a treatable condition, and we see young people recover from BDD every day in the work that we do. So there genuinely is hope.
And I think I would just add, and I know you've probably all know about the BDD Foundation because that's probably how you came to be on this webinar, but their information is updated all the time, and there's so many different resources that you can access via their website. So as a parent, I would really recommend their website. They also have a young person's website, a youth website, in case you're not aware.
Okay, thank you, everybody.
Thank you.